Well, I'm a neurosurgeon, and in neurosurgery involves the treatment of the brain and the spine. I personally had training emphasizing spine more, and that's been the bulk of my practice for the last 15 years. In general, my philosophy is to treat patients as conservatively as possible and let our own body's natural healing mechanisms get us better after an event or an injury, something painful in our lives. For the patients, the smaller percentage, however, who undergo those sorts of treatments and are left with significant pain and disability, then we look at possible surgical options. In general, less is more. So neuromodulation is an alternative to sort of going to what necessarily may be the, quote, root of the problem, which may be damaged beyond repair, and instead accepting that that is the case and that we have an alternative way of blocking out the pain and allowing the patient to get active again, engaged again in physical therapy and weight loss and living a more normal life and getting better again. Spinal stimulation is used in a variety of different ways, but the most common way is to block out pain in the low back and the lower half of the body, one or either extremity. The spinal cord stimulation device is completely under the patient's control. They're able to turn the device on, turn the device off, pick different settings on it with a small remote control that's at their disposal. So the two primary roles for intrathecal drug therapy are essentially patients who have severe spasticity from cerebral palsy, from strokes, from spinal cord injury, accidents or trauma or tumors. The other primary use for intrathecal pumps is for pain management in patients, again, who really have exhausted every good option to improve their quality of life and reduce their pain. An intrathecal pump basically gives them an opportunity to get a level of pain relief that can't be achieved with oral medication. The most satisfying part about this type of work for me is that there are many patients who were essentially homebound, spent 90% of their time at home, either laying down or sitting, who are now able to go to the mall, drive, walk every day, have just a more normal daily existence. And to me, that's incredibly gratifying.